Students, a very good morning to one and all present here. Hope you would have been liking the classes as conducted earlier. Today's class shall bring you at par with the other existing GDA students. So from the next class, you shall be attending from 8 to 10. You can tell me if you have any queries regarding the previous class. Do you have any queries?
No question.
So today we will be starting with assisting patient in the elimination process. Now I believe the PPT is visible to you all.
Hello. Yes.
What is the meaning of assisting patient in the elimination process? The patients who are ill, they are not in a position to actually go to the bathroom and do the elimination on their own. So, the GDA person, it is your responsibility to help the patients in the elimination process. How will you be helping? We shall be seeing in the next slide. Now, when a person is there in the bed, there can be few options through which we will help the patient eliminate their waste products. Waste products are of two types. First, the liquid waste products, and second, the solid waste products. So, when a person is having urinate, we can take the patient to the bathrooms and help in the elimination process. Some patients are not able to locomote from one place to another. That is, they are not in a position to move from their bed to the bathrooms. So, we have to provide them with bedpans.
Can you restart? We just had a little problem with sound.
Okay, no issues. The elimination of a patient is of two types. First is liquid, second is solid. The liquid elimination is the urination process. The solid elimination of a person is the fecation process. Now, in the urination, if you are going to help the patient urinate, you have to take the same patient to the bathroom and help that patient in the process. Some patients are very ill. They cannot go to the bathroom from their bed. So, those patients need to be provided with urinals or bedpans in their bed itself. As you can see in the picture, I am marking it. This is a bedpan. This bedpan is just like the urinal in the bathroom. The patient is provided with the same in the bed only, and the GDA person needs to take care that the patient is successfully eliminating the waste products. Next, we move on to cleaning the patient after elimination. This is a mandatory procedure that you need to put on your gloves before assisting any patient for the elimination process. Because as a GDA person, like you are pursuing the course, general duty assistant, you also have to take care of yourselves. So before touching any patient, in order to not contract any kind of diseases, please be sure that you put on your hand gloves. Now, we will be moving on to cleaning the patient after elimination. How are we going to clean the patient? Firstly, we need to gently roll the patient to the side. A patient who is just lying down on the bed cannot eliminate any kind of waste products. Likewise, we need to roll the patient to one of their side, either the left side or the right side. Now, we need to clean the buttocks of the person with toilet paper first. This procedure is followed mainly with old patients and with those patients who are not in a position to move from their bed. Otherwise, the patient can clean himself or herself on her own. Based on the gender, for example, if the patient is a male candidate, a male GDA person would be assisting the male patient. Likewise, if the patient is a female candidate, the female candidate must be assisting the patient in the elimination process. Next, we will move on to taking a clean towel. We are going to wet the towel in lukewarm water and then clean the area. We will be using soap. Soap is a disinfectant. It actually kills the germs. You might be wondering why we actually wash our hands before eating or anything, like why we sterilize our hands. When we put on soap or any kind of sterilizers, what it does is it kills the germs that are present on your hands. Contracts the germs, takes out the water from them, and thus those germs die. So, soap is a disinfectant. It is going to kill the germs that are present in the body of the person. A patient on itself contracts a lot of germs because of the diseases he or she is carrying. Moreover, in a hospital, you are always subjected to many kinds of infections. So, you make sure that you clean the patient with soap water, and it is also a procedure of actually helping the patient in the bathing process. As told in the earlier class, you need to actually keep the patient very clean. So, we are using soap and water to clean the area very well. Now, we are going to dry the person's legs. If you are leaving the person with wetty legs, the person might be slipping at any moment, or he can contract cold and cough due to recurrent or due to subjecting that person to water again and again. So we need to dry the patient. Now we need to check the skin for redness or soreness. What is redness or soreness? Due to accumulation of waste, our body sometimes turns red or sores, that is, it gets inflamed. So, what do we need to do is we will make sure that the patient is very clean in order to avoid any kind of redness or soreness on the skin. Do you have any doubts in this slide?
No.
Okay. Now, helping the patient while using urinals. This part shall be told in detail by Mr. Kumud, our trainer.
Good morning, students.
Morning, sir.
So I will continue the chapter with the lip topic. The elimination process maintaining in the hospital for different patients, as ma'am has told you, for different patients we maintain the elimination in a different way and helping the patient according to their body condition and the movement. So this topic, the helping patient with using urinals. While helping the patients in urinal, first you need to cover or put gloves, disposable gloves in your hand, so you can use the materials which are used during the urinal process, and you need to ask the patients where he or she is comfortable to move or go to the washroom or not. If they are unable to move to the washrooms or to the urinal, then you have to arrange a disposable container in which the patient can put off their urinals. If help needed to persons for separate the legs during the process, then you need to help them according to the need of the individual patient. In case of the male patient, if they require extra help, then you need to help them out, and all these things must be done to keep in the mind that the privacy of the patient must be maintained during the elimination process, because any individual who is performing with the process is in a very private maintain very privacy for this process. You need to help them out according to the condition of body, according to the comfortness of the patient. When he or she has completed the process urinal, then you need to remove the container and you need to wipe out the lakes, the areas which might be get wet or get contaminated during the process. So the any kind of infection chances could be prevented. So these are the points you have to maintain while helping the patients in the urinal process. Do you have any questions?
No.
Have you done it?
Yes.
Okay. Then come to the next point, maintaining hygiene. While working in a hospital, hygiene is a very important topic or related issue which is compulsory to maintain within the hospital for all, for the staff, for the GDAs, for the medical staffs, non-medical staff, patients and their family members, relatives. Because maintaining good hygiene in a hospital leads to the good health of the patient. Any kind of issues with the hygiene leads towards the various kinds of infections which occurs or spread in the hospital from one person to the another. So in this process also you need to maintain the hygiene according to the rules and regulation. Take the bedpan or urinal to the bedroom and the empty toilet. When patient completed their urinal process, you need to throw the waste product generated by the patient to the particular place where you can put off that waste so that any kind of infections or maintaining hygiene cannot be affected. Then you need to clean that bedpan, urinals as needed with the disinfectants, soap or the solution which are being used to clean that washrooms and areas where the urinals are there in the hospital. Then you can also use to bleach powder for the maintaining or using it as a disinfectant. If there is any sort of or any lack for these kind of materials for cleanliness of the urinals or the bedpan, you need to ask the healthcare provider that the proper system or the proper requirements, requirements are being provided by them so that you can just maintain the hygiene. Then you can clean it up by also using the warm water on a bedpan and dry it. a metal bedpan remains hit. So whether you need to check it out that using it again for that patient or for the different patient, you need to check it out that whether the bedpan is still warm or is comfortable for that particular person or not. Then come to the point urinary catheterization. The patient who is unable to move or leave their bed, or the critical patients, for such patients you need to use this kind of catheter which helps the patient to remove their urinals or put out the urinals from their body without moving or without going to the urinals. So for such patients you need to use the catheterization which helps the patient in diagrams. As you can see how it is being used, can be inserted in the area where the urinals comes out, and a bag is attached with that catheter in which the urinals are stored, and when the process is being completed, then you need to empty that bag to the urinals or to the washrooms. There are two types of urinary catheter. One is intermittent catheter and indwelling catheter. One catheter is being used while patient is in serious condition or is unable to move. Another one is used for the patient who is having the kidney problem. Then assisting mobile patients with the use of commode. What kind of the support or the assistance need for such patients? You need to use or supply the disposable gloves, toilet paper, wipe, container with warm water, soap, washcloth, towels. And after uses, there are some guidelines for the GDAs. Post use, that is also called as post uses guidelines for the GDA, that put on a pair of disposable gloves, helps the patients to stand, use toilet paper, wipe or soap, water to help the patients clean and the areas of the urinary system, and help them with the towel so they can dry the area with the help of towel. Then must needed is help the patient to wash and dry their hands also, because the uses of hand is completely necessary during the process. Just you need to write down all those points, because these are very similar to the points which are being discussed in this chapter. Just you need to follow these points or maintain these points while assisting the patients in the urinal process. Just write it down, all those points, and the materials which are being used during assisting the patients in urinal. So these points are very important to maintain the hygiene in a hospital while assisting them for the urinal process, to cover yourselves and the others with any kind of or any infections which might be generated from the urinal areas, or it might affect the other healthy persons, or the other healthy persons also can infected by the other contaminations from the patients. So you need to keep all these points and use the guidelines while helping the patients in urinal process. Okay, done?
Not yet.
Okay. Let me know when it is completed. These are the very important points regarding the elimination process. So you need to maintain all these points while working in a hospital with patients. Yes.
You can continue.
Okay, completed?
Yes.
Okay. So, this is the end of this chapter. The assisting elimination process. If you have any doubt or queries regarding the same, then you need to ask a question or need any clarification. Let me know so I can help you out. Any doubt? Any queries?
No queries.
Okay. Is the other students like the old batch students are there? Or still they have not arrived?
They are around.
They are arrived.
They are arriving now.
Oh, arriving now. Okay. So for new batch, we will end the class here and we'll resume after 5 to 10 minutes with all the students. Okay. So it's a 5 to 10 minutes break. After that, we will resume the whole class with the current topic. That the communication part is left. So take a break for 5 to 10 minutes.